it's the only connection to the earth. So they're rather important in terms of how we function and how we feel and how we walk. So Arlene has been working on feet. She's a registered nurse and advanced foot care nurse and educator who is the owner and operator of Arlene's Healthy Heels and more. Arlene's mission is to empower individuals to advocate for themselves in all aspects of their health, including their feet, which is their foundation. Arlene has been a registered nurse since 1981. It's a while. She beats me with a varied background of 36 years in acute care nursing. A graduate of a nursing program at St. Clair College with additional credentials that include an advanced foot care certificate. Sorry, I lost my place. I really need to make it bigger, but then it doesn't fit my screen. Okay, from St. Clair College, and she's a foot care educator certificate from Foot Care in Kingston. She established a part-time home-based foot care business from 2003 to 2009. Then in 2010, to meet the needs of her growing clientele, she opened her own foot care clinic, Arlene's Healthy Heels and More. She's become a leader in the foot care education, including the provision of foot care training to fellow nurses, and is the founder of the International Foot Care Network. Arlene is actively engaged in committee and advisory roles in the RNAO and CAFCN, and is a frequent speaker at healthcare conferences and events around Canada. So you're busy. So I'm going to welcome to the podium. Thank you.
Thank you, everyone. Happy New Year. And I'd like to thank Leanne Souzer for inviting me today. Also, thank you, Rotary, for all that you do for the community. Thank you. So my name's Arlene. I'm crying. I think it's because I sang "Oh Canada" this morning. I was in grade school. That was beautiful. I think we have to recognize.
Don't do that. We cry when we sing.
It touched my heart. I even forgot some of the words. I'm sorry. Okay, so
you'll have to come back and sing with us again.
Yeah, I like singing too. So my passion is feet, and I love nasty feet. So I'm a little bit weird like that. So if you have non-problematic feet, no issues in your tissues, don't waste your money and come and see me. If you have issues in your feet, such as calluses, corns, crooked nails, ingrown toenails, I can help you with that. Okay, so you can die from a bad pedicure. Okay, a pedicure and medical foot care is not the same. So medical foot care is done by a professional, whether it be an RN, an RPN, a podiatrist, or chiropodist, okay, where they use sterile instrumentation. So sterile instrumentation meaning that it has been sanitized, put in an ultrasonic cleaner, steam sterilized in an autoclave, which takes about 2.5 to 3 hours, and packaged in these instruments. So they're sterile to the point of use. Okay, I can take your appendix out with these snippers if I needed to, but I'm not a surgeon, so I know it's in the right lower quadrant, but I'd probably miss it because it's pretty small. So it's really imperative that you have, if you have any comorbidity, such as immune suppressed, you're a cancer survivor, you're a diabetic, you have arterial disease, you have peripheral vascular disease, you have poor circulation, you put your feet down and they're cyanotic, so they turn blue or they're very, very red in color, you've got some issues. If you've had coronary artery disease, you probably have issues in your feet as well. Okay, so you need to go to a foot care professional. My mission is to prevent anyone from ever getting an amputation, but unfortunately a lot of patients come to me after they've already lost a toe or a foot, and then they think because they've lost a foot they can get it for half the price. And I say no, I still have to steam sterilize, and the processing of instruments is still the same even though you just have one foot. I'm sorry you don't get a 50% discount, but try to humor them. Did you know that when a patient receives an amputation, 50% of them will die within 3 to 5 years? Okay, so if you're dealing with somebody that say has arterial disease of some type, they go for a foo-foo pedicure, they end up with an infection, then they lose the toe, then they lose the foot, then they lose the lower leg, then they lose the entire leg, and then they lose their life. Okay. So it's really imperative that you spread the word to other people, okay? Because there's a lot of places that are opened in Windsor, Canada-wide, where they're dirty places. I'm sorry, I'm not naming names, but the only way those places will be shut down is if you've had a gross infection or even a minimal infection where you're required to be on antibiotics by mouth, then you should call public health, because otherwise they are not inspected. And I've called public health about it and they said, we don't have time to be going to every corner to check these places out. Okay, you never want to put your foot in a foot jet spa bath, because those incoming jets, they can't clean those properly. So if you look in those holes, it's filled with black stuff and all kinds of stuff. So if the woman or man before you had MRSA, VRE, hepatitis, HIV, guess what? Your cleanly shaven legs will get the same disease. Okay, so it's really imperative that you ask the question. Even high-end spas, some places may steam sterilize or autoclave, but the term sterilization is overused so many places. They'll say, yeah, I sterilize. And then you say, well, how do you do that? Well, first you have to know what sterilization means. And a lot of times, and I visited a few of these shops that are on every corner, I've gone in as a layperson to say, hey, can I see? And she brings me to the back where there's a toaster oven and it says sterilizer. She opens the door and it's a blue light. That does nothing. Barbasol does nothing for instrumentation. High chemosterilant disinfectant spray does nothing, because you still have that 1% chance of getting something else. Did I scare you all again?
Terry just gets.
So it's really important that all of my instrumentation is actually sent to Chatham Hospital, because my clinic is so big that I don't want to be sterilizing all day long. So we don't do the processing part there, but we do the sanitization, we package, then we bring it to Chatham. Every Saturday morning, I have a contract with them and I've had for years, and then we pick up the load every Saturday afternoon. So I'm going to pass this around because this just shows you, the sticker on there will show you the date it's been sterilized. It will show you that biological and chemical indicators have been done. So as a foot nurse, there's higher and higher standards as far as sterilization. Through Health Canada and Public Health and so on. So some of the foot nurses are getting out of foot care because all they do is basically, some of them put them in their dishwasher and think that's okay. Some of them will clean them with an alcohol swab and they think that's okay. It's not okay. Okay. So I am also an educator. So it's really important that if you work for me, you have to take the training, which is Foot Canada training, which used to be Kingston Foot Care. You also put something in there about me being part of the RNAO, which I'm not. I was on the Canadian Association for Foot Care Nurses as an Ontario advisor, and I did a 2-year term for them as well. My clinic consists of 5 nurses, RNs and RPNs. They have to take the course in order to work for me. You will not do somebody's feet unless I have seen the feet with you the first time, because it's about customer satisfaction, not being sued, making sure you're doing things right. We assess the patient's footwear, we assess the way they walk, we watch the way they stand, we do health teaching extensively throughout the day. We offer them things like pressure offload. So if you ever have any issues with your foot, so here's a foot. It's not a real foot, of course.
Oh, yeah.
But if you take your shoes off and you realize you've got redness on one side, or there's a blister here, or there's corn here, chances are your footwear is not adequate. Okay, so this foot has a lot of issues. You can see she has a high arch called pes cavus. There's going to be a test, so remember this. You might win a prize. Pes cavus is a high arch. Okay, this woman has a fissure between her toes. That's a crack. It's bleeding. You got to remember that any open door, any crack on the body, in the skin, anywhere is an open door for bacteria to enter. So be aware. If this patient's a diabetic, she could end up with a gross infection, possibly death, if she becomes septic. Okay, so again, if you know of anyone that has any comorbidities where they need really good foot care, please send them my way. I do pro bono work too, so it's not all about wanting the money to, you know, do their foot care. If they're desperate, they come to me, I do it. It's no charge. But if I know that you're smoking and you drink and you go to the casino and you've got the nicest electric wheelchair in Windsor, then you can afford to come and see me. Okay, I did get pro bono work several times, and then I see them out and about smoking, and you know, it's like, okay, put some money aside for foot therapy. Okay, because if you cut back on your cigarettes, it's going to increase your life. So patients with diabetes and patients that smoke are 3 times higher risk of heart attack and stroke. Okay, so this lady here on the top of her toe, she has a corn, right? And then she's got a crack in her heel or a fissure as well. So all of those things can introduce infection. So she needs to see me. So I'll pass that around. Please be careful, don't drop it or crack it because it's $100 phone. Thank you. Now regarding foot files, and I wanted to just let you know the difference. This is a foot file that's made of wood. It's got sandpaper, coarse and fine on either side. This is a foot file that should only be used for your personal use. If you're going for pedicure somewhere and they're using this, run the other way, because this is something you can never steam sterilize. It's porous and it's meant for your family or just for you. Okay. This foot file is a stainless steel foot file that if you were to buy it, it's worth $80. It's multi sterilized, and it's excellent. So it's got a coarse and a fine side too. Okay. So this is the only foot file that should be used by you in your home. And I know that there are pedicure places that are using it on my clients because I've asked. Leanne has to be muted, I think.
Leanne, can you mute, please?
So this, if you ever go to a pedicure place and they're using this, you're putting yourself at risk for fungus, which is tinea pedis, infection, all kinds of things. Okay. And that's just your regular paddle. Now here's the foot. This is a beautiful foot. Does anyone know how many bones we have in the feet?
Lots.
A lot. Okay. Anyone venture a guess?
48.
48, less.
Thousands?
No.
230.
Okay, so 26 bones in the feet. Okay, every one of my nurses that work for me can tell you every bone where it is, because I tell them you have to articulate the bones, know what they are, teach the patient, and so on. Okay, so I know these bones like the back of my hand. There's also 2 bones on the underside of the great toe, which are called the 2 sesamoid bones. So if you include those, you actually have 28 bones in your feet. Okay, so I'll pass my skeleton around. So your feet are really, really, really important. And like someone was saying before, that it is our foundation. So if your foundation crumbles, what do you have? Nothing. You have a wheelchair. That's what you have. Okay, so prevention is number 1. Also at my clinic, we do just ingrown toenails. So if someone calls and says, hey, Arlene, I've got this ingrown, I will actually take that spicule out. So there's a little area, a lot of times, and I found this just over years of doing foot care for the last 16 years now. No one ever taught me this. No one showed me in a book, but it almost landmarks on your body where that ingrown is. So you almost get that bullseye effect. And most commonly ingrowns are around the great toe. So the big toe, inside or outside. And then if that festers, then you end up with antibiotics. Sometimes the patient tries to remove it themselves. And then if they have issues with circulation, guess what? Now they're in the hospital with an amputated toe. So we use sterile procedure. I'm the only one in my office that will remove ingrowns, mild to moderate. If it's real severe and it's gone down into the nail bed area, then I send them out to a podiatrist or a chiropodist. But podiatry in Windsor, if you don't have any coverage, you're looking at $150 consultation fee and $350 each side. For me in the office, I charge $50 for an ingrown, and you're in and out in 5 minutes. Also, we also have this bracing system, and if you have an ingrown, this is called OniFix. So my staff have been trained on this. And basically, it's a bracing system out of Germany where we apply a composite, a soft composite to the nail, and it's custom made. And then I use a special blue light, harden it on the nail. We put that on, it's $60 plus tax per toe. And that stays on for about 3 to 4 months. And then we put a second device on, and then within a year, that entire nail is now wider than what it was, and the involution, which is like the curling, it actually flattens the nail and it's very effective. So we do that procedure as well. You don't have to come for full foot care. If any of you even want to just come for assessment, free assessment, 10-15 minutes, call the office and I will do that for you. You're going to learn a lot about your feet. Yes, sir.
On the, but it says Arlene's Healthy Heel, that's the number we should call.
Yes.
Okay.
Okay, don't lose that. Put that on your pillow. I'm just kidding.
Oh,
I also sell really nice diabetic socks, and actually I don't advertise a lot, it's word of mouth. But you cannot buy these anywhere in Windsor. I had a woman that just came in before Christmas. She's like, oh my gosh, I've been looking all over for these. They're 98% cotton. I charge less than what the big box stores charge. I decreased my prices by about 20%, and they're very, very beautiful socks. And if you're a client of mine, you usually get a pair at Christmas. I also do some pro bono work downtown at the Centcourse building. It's geared to income housing. So we've opened up a wellness clinic there, which they do hair, and then I do the feet. And the patient will pay $5. It doesn't go to me. It goes back to the center, and you see a lot of nasty feet. And we have shoes there. So a lot of my clients have donated a lot of shoes. So I have like 200 pairs of shoes there that we give out. So you know what? I find my job very rewarding. I love it. My last job was working in the ER, and I understand you work there, Ellie, in the ER?
I work in ICU.
I see you. At OLET campus or Mac? Okay, so I was at OLET campus 22 years in the ER, and I'm glad I'm not there now. Like people say, Arlene, why did you quit? Like I took an early buyout, but it's like money isn't everything. I need my sanity, and this way I can basically take as much time as I want with each patient, and they're like my family. So I just thought we could have like a Q&A. Do you guys have any questions? Yes, sir.
So Arlene, asking for a friend. If you were experiencing the neuropathy.
Yes, due to diabetes or something
No,
else?
not diabetes.
Okay,
And you knew that there was an issue with the lower back and,
Uh-huh.
and that sort of thing. Are you the type of person to go to, or is that sort of?
well, my concern with the neuropathy is you can have diabetic neuropathy, which is due to the diabetes and the effect of the nerves on the system. So we actually do in-low 60-second foot screen. We assess the foot. We check pulses with a Doppler. So we have little ultrasound machines that we use as well. My concern with this person you're talking about, which probably is you.
Yeah.
Would be that because you have neuropathy, you're not going to feel when you walk on something. So you could break a dish in the kitchen, walk on that and have it embedded in your foot that you can't see until it festers. And now you're like, oh my gosh, I have pain in my foot. So you with a neuropathic foot, if you ever have pain in your foot, that's a red flag that something bad is going on.
So the problem, the neuropathy and the lack of feeling caused what I think was a broken toe because I couldn't
Feel it,
feel it.
right.
And now I'm dealing with the neuropathy and what I think is a poorly healed broken toe.
Okay, your
Which
big
is-
toe?
No, the second toe.
Okay, your
Yeah.
second toe. So your big toe is your first toe. So we say 1, 2, 3, 4, 5.
Yeah.
Okay, so the first digit, second, third, fourth, fifth. So with your second, is your second toe longer than your first
It
toe?
is, yeah.
Okay, so you have what's called as a Morton's toe. So people with second toes longer than the first toe, that's not normal. They think it is, but it's not normal. Just kidding. Because- yeah, when we walk with our great toe, right? So we
Right.
toe off, heel, midfoot, and then toe off. But someone with a second toe longer, it's called the Morton's toe. So you toe off differently. So with that second toe, now it's affecting your gait, it's affecting your knee, it's affecting your hip, it's affecting your back.
Yeah, you're telling me things that I probably.
Yeah. Do you go for, or this person that you're referring to?
Yeah.
Do they go
Well,
for foot
Deborah
care?
and I have sort of worked on this together.
Okay,
But
well, feel free to come and see me and I can assess your feet.
it-
I
it
don't
may
really
be
want
a
to take
place
off
to
your shoes
start.
and socks now.
What's that? Yeah,
don't
I'm not
really-
gonna do that.
A lot of people do that in airports, offices, like, can you see my foot? Sure, no problem. Any other questions? Yes,
Is pes cavus more prominent with females than males?
good question.
That's because I was paying attention, everybody.
I'm not sure on the stats with that. I do have several males with pes cavus, which is high arches, but females as well, so.
I didn't know if it was related to the shoe wear. That's-
No, a lot of times it's genetics, right? I mean, you get women that wear, 4 to 6 inch stilettos, it's gonna shorten their Achilles tendon, right? So now they can't step down flat.
Thank you.
You're welcome, thank you. Yes, sir.
Most common thing you see on TV regarding feet nowadays is all this advertising for toenail fungus.
Yes,
Creams.
yes.
Is that common? What's the best treatment and that kind of stuff?
Toenail fungus is very common. 2/3 of the population have it. You have to recognize and understand or try to ask yourself, how did I get the fungus? Fungus is also known as onychomycosis. Okay, so if you want to try to spell that, you might get a prize. Don't look at your phones. So onychomycosis or fungal infection is very common. You see it much more now than you did, say, 50 years ago, probably because we're wearing man-made shoes. There's nothing breathable, everything's synthetic. When you do cause trauma to your toe, fungus usually will move in. When you have fungus on one toe, it can spread to all the other toes. Okay, so be careful. A lot of times when someone has athlete's foot, also known as tinea pedis, they have fungus as well. So you can actually cross-contaminate if you're playing footsies with your spouse, you can actually give them fungus as well. So it's really hard to eradicate if you've had chronic fungus. I don't recommend that you take anything by mouth like Lamisil. It can put you in liver failure, which is it really worth a toe to put yourself in danger and cause liver issues? I guess they're not doing liver enzymes anymore like they were years ago because there was only a couple of cases where patients had liver issues, but be cautious. There's a lot of topical stuff that, yeah, it can work sometimes, but foot nurses across Canada, we were actually implementing and trying on patients just straight white vinegar, and it was very, very effective. So cutting the fungal nail out, like getting rid of that rotten apple that's in that bushel basket. If we don't get rid of that rotten apple, that, you know what? The entire crop is going to be destroyed. So what I do is we pare it right down and then clean it up. Try to consider the source, how that patient got the fungus, get rid of those stinky rotten shoes that the man's had in his garage for 10 years, because he always pulls them out to do the lawnmower. Cutting the grass, they've been wet. If they have a smell, if you can't wash them or sanitize them, throw them out. Okay, sometimes it's undiagnosed diabetes, so you've got high blood sugars and you didn't know about it, right? So fungus loves to live in a dark, moist place. Now, for my women out here, it's really imperative that you don't polish your nails 365 days a year. Okay, 1% of the population can get melanomas of their toenail and their foot, which can cause death. It can kill you. It might appear like a freckle or a line. If you have a new freckle or a line or a mole on your foot, you need to get it inspected. So in the last 15 years I've been doing foot care, I've had 5 patients that I've picked up melanomas on. So let your toenails breathe, right? Yeah, if you're going, on vacation, you're going to a wedding, it's fine to have polish, but then take it off and clean it up. Okay? Yes?
I'm gonna use your foot as a prop,
Okay.
the white foot.
Right foot.
The white,
Skeleton.
the skeleton.
Yeah.
The bones.
Okay, so these bones, in between the joints is cartilage, right?
Uh-huh.
What happens, what would make the cartilage disappear?
Arthritis,
Okay, and
injury, right? If you've had fractures there where you've had confused or some other issues or disease of any type with the bone.
and there's nothing anyone can do.
Sometimes they can do joint replacements.
Any non-surgical
They are injecting toes, but if there's no cartilage there, you know, like the orthovisc you get for your knees now, where the surgeon will say, come on in. And a lot of my patients get sucked into this. Come on in, pay me $1,000 and I'm going to fix your knee. If it's bone on bone, there's no medications that's going to make cartilage. There's no medication that's going to build up that cushion that you've lost, right? So that's why you need a knee replacement. Or many of my patients come in with severe bunions. So you've got that growth on the hallux, which is the great toe. Then you've got arthritis on top of that. I had one patient, his foot was this big. What I would do is foot care. Okay, and he wasn't a big man. He was a tall man. He received a joint replacement where they took that whole joint out and replaced it. And that was 15 years ago, and he's doing awesome. Sometimes they're reluctant to do that here in Windsor. So make sure you get a second opinion, right? It's important.
Okay.
But don't always just pay to say, okay, here's $500 and fix it. If you know it's bone on bone, chances are that injection isn't going to help you. There's cortisone that's going to help with the pain. But again, if you've got something like a fused joint or there's no cartilage, it's again affecting your gait, your knee, your hip, your back. It's like all connected. Yes, sir.
So one Saturday morning on my way to get a newspaper, I stopped into McDonald's and I was enjoying my egg McMuffin, and there was a lady sitting behind me who was loud enough for me and everyone else to hear, talking about the benefits of grounding. She watched a documentary and she highly recommends. She gets up in the morning and she takes her shoes off and goes out into the yard, and apparently this grounds all the electricity that comes through our feet. So I laughed it off and went home and stood out in the yard. Probably the damage from the snow and the ice. Grounding effect that it had. Do you have any thoughts on?
Well, grounding is good. I mean, if you do yoga and you're into self-care, I mean, grounding is awesome. But if you're dealing with somebody that has neuropathy, that can be dangerous. So I wouldn't be grounding outside.
Okay.
You want to keep your feet close to the earth, right? So it gives you connection, right? I've done a few yoga classes, but no, grounding is good, but not if you have a neuropathic foot where you're not going to feel if you step on a stone or a piece of glass.
Sure.
Okay.
Okay, very good.
How's our time? Am I too long-winded or is it good?
No, we just,
What?
we don't
what
have
is-
to do it immediately.
Yeah, what is an ingrown toe? Like
An ingrown toenail causes you severe pain, also known as onychocryptosis in the Latin term. Onychocryptosis or an ingrown toenail can appear on any toe, but very, very common with the great toe. So number one, right, your big toes. Sometimes you'll have it on the second, third, or fourth toe, not on the fifth toe, not on the baby toe. But it causes pain. Usually there's pus there, and you feel like wanting to dig it out yourself. It can be a genetic thing if you have involuted nails, so your nails grow like this because your parents had toes like that. It could be caused because your shoes are not wide enough. So when you've got issues with ingrowns, it's important to get enough room in the toe box of the shoe, right? So that the first part of the shoe where your toes are encased in there, make sure that you're staying away from shoes that are pointy. You want something more forgiving and rounded. If you're dealing with a running shoe, don't get something with a seam right on that big toe. Get something that's more fibrous, like stretchy. Okay. Does that answer your question?
yeah, no, I was just
Oh,
curious.
okay.
Where
Yeah, you're lucky you haven't had them, but your
Girl.
feet change because as we age, the bones in our feet start to dissipate and now our foot becomes wider, longer. Right? Because you lose your arches. How many of you experience calluses under your toes? Anybody have calluses? Okay, so callus under which toe? Okay, so the third
Third
toe.
toe.
So that you're developing a callus because you've lost your transverse arch. So we have two arches to our feet. We have our medial longitudinal arch and we have our transverse arch. So if you lose your transverse arch, you dropped your metatarsal heads. So these bones here under each toe, you have a metatarsal head. So when you drop that, you've lost your arch. So really imperative that you never go barefoot in the house. You always wear supportive shoes or slippers. Birkenstock sandals are excellent. Not everyone can afford orthotics. So let's talk about orthotics real quick. When you go to get orthotics made, you should only get them made by 3 different designations, okay? A podiatrist, which is a doctor of feet, a chiropodist, which is an interchangeable term in Canada, but a little less education than what the podiatrist has, because I know a husband and wife that share the role, or a podorthist. A podorthist is someone that goes to school just to make orthotics. Okay, so you need to go to one of those places. But if you have a high-end shoe with a removable insole, orthotics aren't always warranted. Okay, they're like $500-600 now since post-COVID. They've really gone up in price. So if you buy a high-end shoe, not a Walmart shoe, a shoe where you've actually spent at least $100 to $200, your feet may be okay, but don't go barefoot, because 20 years from now, you're going to end up with an ulceration under there, which is full, leading to osteomyelitis in the bone, infection, and a lot of problems. A lot of my average age that come into my clinic, I'm going to say 60, but I've had 102-year-olds still driving. So they come in as well. And sometimes babies, infants will get ingrowns as well. So we see a wide range. A lot of times when patients come to me, it's like a 15-year commitment, because now they can't do their own feet. They're relying on me to be their eyes and their hands. Yes, sir.
You mentioned a husband and wife team. Is it James and Millicent?
Yes.
Okay, so the work that you do, how does it differ from the work that James and Millicent?
There's no, you know what? James and Millicent, they run their office and their clinic. Like, I almost moved in there like a few years ago, but that's a different story. No, she's a friend, she's a nice lady, but they're physicians, like I am not. I'm a foot nurse, so they do surgical stuff. Millicent can actually do surgery on the forefoot. I've watched bunionectomy in her office on one of my patients. She actually allowed me to watch. She uses no general anesthetic. You're awake for it. She takes the
Oh, nice.
saw out. You hear the electric saws, it's cutting the bone, and you get just needles, and it's cash, right? Like, you can actually try to get that on your income tax at the end of the year, but you're looking at, for a bunionectomy in the office, $3,600. That was pre-COVID, right? But as a podiatrist, she knows 10 different ways to do a bunionectomy. An orthopod only knows 2 to 3 different ways. That's what she's told me. And she spoke at a couple of my conferences, so.
But as far
Yeah.
as an assessment goes.
And as I haven't really, I followed her one morning in the office and we ran around together, but she does the calluses and foot care. A lot of them don't wash the feet, we wash the feet. So that's what makes us different. I also did the pedicure course at the college, which I loved, and it softens the nail, and actually it's less painful for the client. So you're in the office for 45 minutes to an hour.
Question.
Yes.
Yeah,
Yes,
quick
sir.
question, what's the correlation or similarity between hands and feet?
Well, if you go for a foo-foo manicure, that's okay, but a foo-foo pedicure can be deadly.
Are you any sort of an expert on hands as well? Is there?
No.
No.
No. Yes, sir.
No, I have someone who's having problems right now with ganglion cyst on the top of their foot.
Uh-huh.
Do you deal with those? Or
Well, hundreds of years ago, they used to take the family Bible and just slap it on there.
Yeah.
Yeah, and ganglions, unfortunately, if you remove them surgically, they can still reappear later. So again, footwear is important, making sure she wears something where it's forgiving on the top of the foot. Okay, so there's not causing constriction, because that'll cause more pain.
But is that something that you deal with?
No. Well, thank you. I'm gonna have, can I draw a couple of, or I've got a couple giveaways, is that okay?
Oh, sure.
Yeah.
I'm like curious too.
No, okay, so. This is whoever answers first. Okay?
That's got us.
That's the only one, remember?
Living grown toenail, Latin terminology. No, what was the
Starts
long
with an O.
word? Good,
Something.
Yeah, that's
right.
I'll do something. I'll do something.
okay, another question, onychocryptosis, you didn't win.
Right, you went.
What do you call a flat foot? And I didn't talk about this.
Oh,
Anybody know?
a shorter.
A cop?
A cop.
Pes planus. Okay, how many bones do we have in the feet, including the two sets? Okay. Look what you
Not
get.
1,000.
You get a free gift certificate for medical foot care. Not by me, it'll be by Nurse Nancy. Okay. What do we call fungus? What's a fancy name for fungus? Latin terminology.
Oh, right.
Yucky.
Yucky. No idea?
No.
Onychomycosis.
Yeah.
Sure.
Okay, so there's onychomycosis fungus, onychocryptosis, ingrown toenail, thickened toenail, onychogryphosis.
Ooh.
Okay,
Okay.
what do we call athlete's foot? Latin terminology, starts with a T, two words. Come on.
Something like
For 10
here.
seconds.
That's bringing in here.
Pedis. Okay. What do we call a crack between the toes, like that woman?
Fissure.
You get socks. What do we call that growth that was on the top of her toe? Is that lip of hard skin? No, small. Who said corn first? There you go. These are unisex socks, by the way. 78% cotton. Very, very nice. There you go. Well, thank you, everyone.
Thank you. Thank you.
Thank you for having me.
Arlene, I'm very happy to say thank you very much. And the great thing about Rotary is you learn something new every time the speaker comes. And I think I learned quite a bit of new things, which is awesome.
Thank you.
I work with the feet a little bit, but that's not the same as you do. So thank you for sharing your
Thank you.
information and your enthusiasm.
Thank you.
And I have a few more years to catch up with you in
Oh,
terms of
thank
these
you.
years of service, so it's good. So we've been giving away honey,
Oh,
locally produced honey to our guest speakers, something that you can use.
Thank you, honey.
and-
It was a pleasure having you allow me to speak here today.